Rockwall County officials reported the first North Texas measles case of the year. Hello, everybody. I'm Heather Hayes.
And I'm Steve Eager. It's 9 o'clock. Health officials believe the patient likely caught the virus traveling internationally. The patient was hospitalized, but we're told is now back home. Officials say everyone the patient was in contact with has been notified. Fox 4's David Santendri has more on why Rockwall County officials are hopeful this case is isolated. David.
Yeah, we just learned moments ago that this is an adult male patient. We don't know any other identifying information about this person, but state and local officials do not believe this one case is connected to that outbreak in West Texas, where more than 120 people have been confirmed positive.
In general, this case seems to be isolated. It seems to be obtained from international travel.
An adult living in Rockwall County tested positive for measles this month, according to County Health Authority Dr. Dirk Parrott. The adult traveled out of the country and returned on February 6th. 5 days later, they began experiencing symptoms.
The symptoms we watch for would kind of start off as a common cold. You'd have a runny nose, maybe a cough.
2 days later, February 13th, they were admitted to a hospital. They spent about a week there and are now recovering at home. Rockwall County says it was only notified by Texas Department of State Health Services on Tuesday of this week.
What Rockwall County Emergency Management and our local health authority have been doing is identifying any first responders that came into contact with this person to make sure that they also had the information that they needed to monitor themselves.
Rockwall County Emergency Management says a group of first responders came in contact with the individual. Those first responders and 3 other people who were in contact with the person are not showing symptoms.
We have relatively low risk right now.
If you've been vaccinated, your risk is extremely small.
Dr. Parrott says about 30% of cases require hospitalization, and about 1 in 1,000 lead to death. The CDC says the measles vaccine is more than 90% effective. Asked about the skepticism some have toward vaccine efficacy in the wake of COVID-19, Parrott noted this vaccine has a long track record.
The vaccine for measles is one of the most widely tested vaccines in human history, and that risk is extremely small. It's not zero, but it's much less than 1 in 1,000, which is your risk of death if you get measles. And I think the community just needs to be aware of that and reassess that on their own individual basis.
State health officials did tell us this person was not vaccinated against measles. I did ask a state health official just a bit ago why there was such a delay in getting this information that this Rockwall individual tested positive in a hospital, why it took so long to get that information to Rockwall County health officials. Nearly 2 weeks. They said at first the patient was having symptoms that didn't exactly seem like measles. It didn't come to mind for people at the hospital, and this person has some other pre-existing conditions. It wasn't until after a while into that hospital stay that some signs showed measles. They got the testing and then eventually were able to notify Rockwall County health officials. Steve, Heather, back to y'all.
All right.